Hi everyone, my name is Ivy Nicole Manadera, caregiver student from Sasin, Iloilo. For today's demonstration, I will perform oxygenation through cannula and face mask. Nasal cannulas and face masks are used to deliver oxygen to people who don't otherwise get enough of it. They are commonly used to provide relief to people with respiratory disorders. Hi sir, my name is Ivy Nicole Manadero. Can you tell me your name and your date of birth? Sir, I'm going to administer oxygenation through cannula and mask to you. If the patient is showing signs of respiratory disease, we can check how well their oxygenation blood using a device called pulse oximeter. Place the device on the nail bed of the finger. Probe should be fitted securely and any nail polish must be removed as it can interfere with the reading. The monitor will then display the SpO2 or percentage. SpO2 in healthy individuals should be between 94 and 100% if the patient's SpO2 is below this level. This would indicate that they are hypoxic and need to be given oxygen. For most patients, when delivering oxygen therapy, we aim for a target saturation of between 94 and 98%. We are going to begin by administering oxygen through nasal cannula. This is recommended as being suitable for most patients with both type 1 and respiratory failure. This is a hollow tube with two prongs which insert into the nostrils. It can be secured in place by taping it behind the ears. The other end of the tube is connected to some oxygen tubing which then attach to the oxygen cylinder. Normally, an award sheathing can be attached on an oxygen tap on the wall. You can control the flow rate of oxygen going through the devices using a flow method. Simple face mask. An alternative nasal cannula is to use a simple face mask. This is less comfortable for the patient but can deliver higher concentrations of oxygen. The oxygen tubing is connected to plastic port at the bottom of the mask. The open side ports allow air to mix it, dilute the oxygen as well as allowing carbon dioxide to leave. Can then be molded to fit over the patient's nose and mouth and secured by an elastic band at the back. The flow rate should be adjusted to between 5 and 10 liters per minute and can be adjusted depending on the target saturations. Winter mask. This has special adapters which vary the diameter flow in order to achieve a specific FiO2. They range from 24 and 60%. The adapters are different colors and display the required flow rate as well as the estimated FiOS. Venturi masks are used in situations where patients may have COPD or other risk factors for type 2 respiratory failure, and the high concentration of oxygen may need to be avoided. Aim for oxygen saturations are between 88 and 92%. Non-rebreather mask has an attached reservoir bag and one-way valves which allow oxygen concentrations of 60 to 80% to be achieved. Once again, the oxygen is connected up. The flow rate is adjusted to be between 12 and 15 liters per minute. The value between the face mask and reservoir bag is suppressed in order to fill the bag up. It can be adjusted to fit over the patient's nose and mouth, similar to previous face masks. If a patient needs high oxygen concentrations, this reflects a serious underlying illness, and it's important to continuously monitor the patient, obtain an ABG, and seek senior medical input. Lastly, oxygen is a drug and may be harmful. It must be prescribed in emergency situations. It can be written up afterwards.